Hello and welcome to our 2021 HealthFlex Annual Election webinar. Our 2021 HealthFlex Annual Election runs October 28th through November 12th, 2020, and this will be the time period that you will select your annual elections for your medical, vision, and dental plans for 2021. The South Carolina Annual Conference is part of the HealthFlex Exchange, and the HealthFlex Exchange is a health plan offered by WestPath for United Methodist Church, plan sponsors, and participants. You have the ability to select between 6 medical, 3 vision, and 3 dental plans, and our plans offer health savings accounts, health reimbursement accounts, and flexible spending accounts. You'll notice that each of the plans that are offered are grouped by color. You'll notice on the left side of your screen over here that we have the HSA plans, which would include the H1500, the H2000, and the H3000 plans. We have health reimbursement accounts that are here in blue. That would include your C2000 plan as well as the C3000 plan. And then we also have the B1000 plan here on your right. The B1000 plan is a traditional PPO plan where there is a copayment. You would pay a $30 copayment for a regular doctor's visit and then a $50 copay for any specialist visit. Notice in the office visits, urgent care, and emergency room areas, you'll notice here in both the HSA plans and the HRA plans, the green and the blue plans, a deductible must be met and before the insurance will pay. So once that deductible is met, then the co-insurance would kick in and would begin paying for its portion of the health care. Again, notice on the B1000 plan that co-payments are made rather than meeting the deductible before the plan actually pays. Also notice for behavioral health visits, for the green plans, the HSA plans, deductibles must be met before the plan pays its portion. The blue plan, the HRA plans, the C2000 and 3000, as well as the B1000, a copayment or co-insurance will begin day one. You do not have to meet the deductible for behavioral health visits. That is also true for prescription drugs on the blue C plans as well as the B1000 plan. On the HSA plans, the green plans on your left, for prescription coverages, the deductible must be met unless your medication is on the preventive drug list. Then the copayment and co-insurance would be applicable. So if you are taking a medication that is on Optum Rx's preventive drug list, then it would pay without meeting that deductible. Notice on the bottom that there are health accounts affiliated with each medical plan. On your left, you'll see that you have the HSA plans that include the ability to contribute to a health savings account through payroll deduction. Some of the HSA plans also come standard with an amount that's contributed to the health savings account at the beginning of the year. Also, with all plans, you'll notice that you can contribute to a flexible spending account for qualifying medical expenses. However, on the green HSA plans, they are limited use for dental and vision until you meet the IRS defined deductible. Then it can be freed up to use for any medical as well. So if you do elect an HSA plan, the recommendation is that you would contribute and elect the amount towards your HSA or your health savings account rather than the flexible spending account, unless you do know that you are electing for qualifying medical and qualifying dental and vision expenses. The blue HRA plans, that represents a health reimbursement account. The HRA amount is defined by the plan design and is contributed to the health reimbursement account at the beginning of the year. You are not allowed to contribute additional funds into the health reimbursement account. However, you can contribute to the flexible spending account. On the PPO plan, the B1000, you can also elect a flexible spending account for qualifying medical, dental, and vision expenses for the following year. What we have before us here is the health account contributions. Notice on the blue plans, the C2000 and the C3000, as I mentioned a moment ago, it does come with health reimbursement account funds, and those funds are deposited on January 1st. For the C2000, for a single coverage, you would receive $1,000 in that health reimbursement account. For family coverage or participant plus one, it would be $2,000. The C3000 with HRA, for participant only or single coverage, you would receive $250. And for participant plus one or family, you would receive $500. On the HSA, the green plans, you'll see that the H1500 plan for participant only or single coverage, you would have $750 contributed to your health savings account January 1. For participant plus one or family coverage, you would have $1,500. And the H2000 with HSA, you would have $500 and $1,000 respectively for single or family coverage. The H3000 plan does not have any health savings account funds contributed by plan design. So any funds that would be contributed for the H3000 plan would be through your payroll deduction. Keep in mind that you can also contribute additional funding to the HSA through your payroll deduction. Notice on the blue plans, the C2000, 3000, and the B1000, the deductible applies per person. So if you were having a medical procedure, you would meet the $2,000, $3,000, or the $1,000 deductible based off the plan that you selected. However, if you cover multiple people in family coverage, you may not meet the individual deductible, but may meet the family deductible. So that would apply in those situations. The in-network coinsurance amount, you'll see across the board where we have what is covered after the deductible. So on the H1500, it covers 80% after the deductible. The H2000 would be 70%, the H3000 40%, and so on. You'll also see below that the table outlines what the participant pays after the deductible. Notice at the bottom of the screen that there is an annual in-network out-of-pocket maximum. So this would be the amount that you would pay in total before the plan would pay 100%. So for example, if you're covered under the H3000 plan and as an individual you reach $6,000 in the calendar year, once you reach that $6,000, then the plan would pay 100% after that. Keep in mind that all preventive care is covered at 100%, and that is for all plans. So your yearly physical, the well child benefits for children under the age of 17, the well adult benefits for 16 and over, those are covered at 100% and do not have to the deductible does not have to be met in those situations. For the primary care physician, the office visits, you'll see the percentage that the plan pays. For all of the plans, with the exception of the B1000, it gives you the percentage that would be paid after the deductible has been met. For the B1000 plan, it would be a $30 copay, then the plan would pay 100%. For behavioral health office visits, you also get the same layout of what percentage is paid. On the B1000 PPO plan, it would be a $15 copayment, then the plan would pay 100%. On this screen, you'll see the outpatient therapies and what each of those plans would pay, specialist visits, outpatient services, and then inpatient hospital care. It breaks down the percentage that each of those plans would cover. Emergency care, emergency room visits, you do have the percentage that the plan would cover after the deductible. Notice, however, on the B1000 plan that if you have an emergency room visit, it would be a $200 copayment, and then the plan would pay 100%. However, if you were admitted, then it would be you would not have to pay the $200 copayment, but you would go against the deductible and cover at the appropriate percentage. For maternity care, you'll notice that prenatal care, except ultrasounds, all the plans cover 100%. And for ultrasounds and subsequent eligible physician charges, you'll see the appropriate percentage that's covered after the deductible. For newborn routine nursery inpatient services, you'll see the appropriate percentage. Also on this screen is one of the benefits that's frequently asked is hearing aid benefits. There is a benefit for hearing aids and exams with all of our medical plans. For all of the medical plans, for hearing aids, it will pay 50% after the deductible, up to $3,000 every 24 months. For the pharmacy plan benefits, you'll notice the structure in which they pay. The green plans pay a little differently from the blue C2000, 3000, and the B1000 plan. You'll notice that the blue plan and the B1000 plan, there are co-payments associated with whether you select generic or name brand medications. That pays from day one without having to meet a deductible. However, on the green plans, there is a schedule of payment, but unless the medication is on Optum's preventive medication list, you would have to meet the deductible before the plan pays. This is something to keep in mind, especially if you are on some name brand medications. You will have to pay the full price of the medication until you meet your deductible. So that is one of the differences between the two plans. But if your medication is on the preventive medication list, then the appropriate charge, the copayment or the coinsurance amount would be covered day one. Now switching from the medical plans over to dental plans. While we have 6 different medical plans to choose from, on the dental side we have 3 plans to choose from, and one of those being a dental HMO plan. One thing to keep in mind on a dental HMO plan, in order for any benefit or any procedure to be covered, the dentist must participate in the dental HMO plan. In order to enroll and elect the dental HMO plan, there must be a providing dentist within 25 miles from the location of your address. In addition to the dental HMO plan, there are 2 additional dental plans to choose from. One is the PPO 2000 and the other is the dental PPO plan. If you select the dental PPO plan, there is an Advantage network that has a higher rate of coverage if you choose a dentist within that network. On the screen, you'll see the coverages, the calendar year maximum, as well as the annual deductibles for each of the plans. On this screen, you'll see the amount of coverage, the percent coverage for various services. On the right side of the screen, you'll see the dental HMO and the cost associated with certain procedures. You'll want to make sure to look at this and see what you may have coming up. If you have some major dental care coming up, such as crown or dentures or implants, for orthodontia for children up to age 19, you'll see the benefit down at the bottom. We also have 3 different vision plans to choose from. There is one that is at no charge, that is the Exam Core. Each of these plans offers an eye exam for a $20 copayment. However, with the Exam Core, there would be no additional benefit for frames and glasses, etc. However, you would receive discounts if you do get contacts or glasses at a provider that accepts VSP. You also have the ability to get a higher level of vision care through the full service of the Premier plan. Each of these plans has additional benefits such as frames, lens enhancements, and contact lenses, etc. Notice at the closer to the bottom of the screen, you'll see for contact lens for the full service, you can get contacts instead of glasses, and that can be done every 12 months for the full service. On the Premier, you can get glasses and contacts, or up to 2 pairs of glasses every 12 months. This screen will outline which health accounts work with which plans. One thing to keep in mind, the HSA only works with the green plans, the H3000, 2000, and H1500. The HRA only works with the blue plans, the C2000 and 3000, and the flexible spending account, or FSA, works with all three. The health savings account gives you the ability to set aside up to $7,200 a year for qualifying health expenses. Of course, that is with family coverage, or $3,600 for participant-only coverage. The advantage of a health savings account is that it carries over year to year. The idea behind selecting a health plan with a health savings account is that the premium is much less expensive than, say, a PPO plan, so you would take the difference and put that into your health savings account to pay for any qualifying medical expenses. As that builds, you would, instead of taking money out of pocket, you would use your health savings account, and you would receive a debit card to access that health savings account. Again, that any HSA funds carries over year to year and even into your retirement. Once you retire, if you have funds in your health savings account, that continues to be your funds and can be used at a later date in the future. Also, for example, the health savings accounts are fully portable, so if you left employment with the United Methodist Church and went elsewhere, that would also carry with you, and it would be your funds in your name. Health reimbursement accounts are a little bit different in that the plan funds or the employer funds the health reimbursement account. So it's not actually funds that you would put into an account, but are deposited in an account in your name. These funds also carry over year to year and can be used in future years. There's a little bit difference. If you were to leave employment with the United Methodist Church, you couldn't carry that money with you. However, if you were to retire, you could carry that money with you and use it for future qualifying medical expenses. Flexible spending accounts, those are more of the traditional health accounts. You can contribute up to $2,750 maximum for 2021 into a flexible spending account. This is the use it or lose it. So you can elect an amount, use it throughout the year, but you would want to be sure to exhaust the majority of those funds within the calendar year. You can carry over up to $500 into the following calendar year, but just be sure to set aside an appropriate amount if you elect a flexible spending account. As I mentioned earlier, a flexible spending account works with all three plans. However, if you elect a flexible spending account with a green HSA plan, those flexible spending account dollars can only be used for dental and vision expenses until you meet the IRS deductible amount. Once you meet that deductible amount that the IRS sets, then those funds can be freed up to use for dental, vision, and medical expenses. However, it would be your responsibility to report that to Blue Cross. However, it would be your responsibility to report that you have met that deductible for those funds to be freed up. One consideration for those who are nearing the age of 65 or are already 65 and still actively working, if you are currently enrolled in Medicare, you are ineligible to select and contribute to an HSA plan. If you are reaching the age of 65 or already 65, you may delay your enrollment in Medicare Part A and continue in the HSA plan. One thing about delaying enrollment in Medicare Part A as long as you are covered under a group health plan such as HealthFlex, there is no penalty for late enrollment in Medicare Part A. Now on to some of the new things for HealthFlex in 2021. Those that have been on HealthFlex for several years may be familiar with the out-of-pocket amounts for the various plans. Westpath has lowered the out-of-pocket maximums for all HRA and HSA plans. So the out-of-pocket maximum has been reduced in these situations for all plans except the B1000. So you'll notice on this screen that all but the H3000 plan has a $5,000 per person or $10,000 per family out-of-pocket maximum. So that's definitely an advantage for 2021. The second thing that Westpath has rolled out that's new for HealthFlex in 2021 is a consistent pharmacy benefit across all plans. So all of the plans have the same benefit with the exception of the H3000, and the H3000 is driven by percentage only rather than co-payments. Also new for 2021 in HealthFlex is WageWorks becomes Health Equity. Many of you have an orange WageWorks card that you may have used for your health reimbursement account or for your flexible spending account. If you do have an orange WageWorks card, it will continue to be active until it expires, and then you will get a new healthcare card. Those of you that are on HSA plans have already been issued a Health Equity Health Savings Account card. So for those of you that are on HSA plans, you may have both a orange WageWorks card as well as a Health Equity Health Savings Account card. Previously, the flexible spending, the health reimbursement, and health savings account was all combined on one card. With this buyout of WageWorks by Health Equity, they have split the two. So if you have elected one plan in 1 year and moved to an HSA plan for another, you may have two different cards. One thing to notice on these cards is do not throw them away at the end of the year. They do continue to work year after year until they expire. Another thing that's new for 2021 for HealthFlex is the out-of-network benefits. While in-network services are more cost-effective, there's still coverage for out-of-network services in all plans. Now the out-of-network deductibles and out-of-pocket maximums are 2 times the in-network deductible and out-of-pocket maximum for all plans, so it's easier to understand. And the fifth thing that's new for HealthFlex in 2021 is an enhanced vision benefit. The Premier Vision plan now allows you to get 2 pairs of glasses or 1 pair of glasses plus contacts. So now you can do 2 pairs of glasses if contacts are not needed for you. Some other highlights for 2021 is the behavioral health. Outpatient counseling benefits are the same whether your provider is in-network or not. Also EAP, remember that there is that benefit that you can get 8 no-cost visits for behavioral health, and then also virtual visits. Or remember, if you're unable to visit the doctor or you have a minor health concern and would like to speak to a physician, you can do so by using the MD Live service. Some enrollment tools to keep in mind is there is the ALEKS utility, and that can be accessed by going to westpath.org and then logging in to your HealthFlex and WebMD account. ALEKS will ask you questions about your scenario, your particular scenario, such as doctor's visits, specialist visits, the amount of medications that you take, and then make a suggestion based on what you enter of which plan would be best for you. Of course, this plan is not a requirement to select, but only a suggestion. You can select any of the 6 plans, 6 medical, 3 dental, or 3 vision plans that you feel is best for you. Also, to make your elections, you'll do that once again at the HealthFlex WebMD logon through westpath.org. And if you do have Any questions or concerns in that, logging in, or any questions on the plans, you can always call Westpath at 844-688-1375. Also, the pricing and plan documents, additional details can be found at umcsc.org/healthflex. One of the biggest questions is, what is the cost for the various plans? And again, that can be found on the conference website, umcsc.org/healthflex. Also, keep in mind that while it may not be necessary for you to, or a requirement for you to go through the annual election process, it is highly encouraged for you to do so. Keep in mind that any medical, dental, or vision plan that you're currently enrolled in will carry over into 2021 if you make no election. However, health savings account and flexible spending account or dependent care account amounts do not. So if you elect a flexible spending account of $1,000 in 2020 with the PPO plan, in 2021, if you do not make an enrollment, the PPO plan will carry over, but the $1,000 election to the flexible spending account will not. After the annual election period, the only changes that can be made to your elections are for qualifying change of status, such as marriage, divorce, death of a spouse, birth or adoption of a child, or loss of spouse's health coverage. You can make changes to health savings account elections at any time during the year, but not flexible spending account or dependent care accounts. With questions, who do you contact? The benefits specialists here at the South Carolina Annual Conference Center are Stephanie Pons Henry and Lynn Jenkins. Their email address and phone number, direct dial phone number, is on this page. Feel free to give them a call with any questions that you have. Also, Westpath has an annual election support line, and that is 844-688-1375. As always, we are glad to help in any way that we can. So if again, during this process, if you have any questions, if you're exploring plans and trying to figure out what's best for you, you've used the ALEC utility, and you just have additional questions that aren't answered through the documentation or through this webinar, feel free to give Stephanie or Lynn a call, or feel free to give Westpath a call at their annual election support line.